Hi, my name is Aftab Patni. I'm a board-certified otolaryngologist with a focus in ear problems. So I have a subspecialty training in otology and neurotology. I would say probably one of the most common problems I treat are chronic ear infections or chronic um, uh, drainage from the ear. So one of the most common reasons people come see me is there are benign tumors in the ear called cholesteatomas, or they have a hearing loss that needs surgical correction. Conditions such as otosclerosis. Some of the most common procedures that I performed are tympanoplasties or mastoidectomies, which means surgical correction of their chronic ear disease, holes in their eardrums, removal of benign tumors from the eardrum, the middle ear, or their mastoid bones. In addition, we do other procedures called stapedotomies for hearing correction. When we're dealing with people with chronic ear problems or chronic ear infections in particular, we try to do always medical management first. Try to do medications and other office procedures that we can to try to get their ear problem to resolve. If that's not the case, then at times, we recommend surgery for them for their ear problems. Frequently, patients, by the time they come to see me, have already seen their general ear, nose, and throat doctors, and their doctor is usually referring them to me for surgical management of their ear condition. So they've usually tried a lot of the medical problems, but if they've not, we certainly go through that process. Some of it is, their fear of anesthesia, being put to sleep for the procedure, and the surgical risks of the procedure. I tell them, most of these procedures are performed under high-powered microscopes. It's done under very safe settings, and we go well out of our ways to make sure, people are not going to have adverse outcomes. Before the appointment, our nursing staff will call them. They need to bring records from their other doctors so we know what treatment they've had done to them already, so we don't repeat things that have not worked. In addition, especially if they've had imaging studies, those are going to be very important for us to have for the visit. So a typical exam involves being evaluated under the microscope. So typically you're seated, and then we lay you down. You typically turn your head away, and we look inside one ear and the other ear for comparison. Usually most people have a problem in one ear and the other ear is normal, but at times, both ears are involved, so we always usually look at the normal side first, so we get a good baseline, and then we evaluate the abnormal side. Some people are very apprehensive when it comes to getting their ears examined, but we do it in a very, very benign fashion. And most of the time, the microscope is used just to magnify, and we're not usually doing anything that's going to cause pain or discomfort.